uncover the hidden world of fear-driven healthcare messaging and its impact on our choices with Dr. Demartini on this episode of the Discovery Doc podcast. Learn how to break free from victim mentality in health and embrace self-empowerment for optimal well-being. We'll also explore the risks of mycotoxins in everyday foods and debunk the myth of 100% vaccine effectiveness. Tune in for an enlightening conversation that could change how you think about your health.
The Discovery Doc podcast, where your journey to empowered, non-toxic living begins. Join me, Dr. Cece, a doctor of nursing practice, self-proclaimed toxin tamer, and mama of four, alongside
me, Anna Kate, your medical mystery overachiever. Together, we'll uncover the latest in functional medicine, debunk health myths, tame toxins, and provide practical tips for thriving in a modern world.
Get ready to take control of your health with expert insights, raw stories, and actionable wellness strategies designed to help you and your family lead vibrant, toxin-free lives. Let's discover together.
Welcome back to the Discovery Doc podcast. We are joined again this week by Dr. Demartini, and we're going to continue our conversation. All right, Cece,
my soul is fired up right now, y'all. If you didn't listen to last week, go back and listen, please, because I hope you are on fire just as much as I am from this conversation.
She's over here buzzing.
I know. She had to cut me off. There's so much, but can you, Dr. Demartini, you kind of left off in a category that I want to dive a little bit deeper into. Can we talk about how fear-driven, specifically fear-driven healthcare messaging can influence those subconscious choices?
There's only two fears a human being face. The fear of loss of that which you seek, and the fear of gain of that which you try to avoid. All fears, all phobias come from those two. There are no other fears. If you look at any moment in your life that you've had a fear about, it's the perception of fear of loss of something you're seeking or the fear of gaining of something you're avoiding. Now, if you're seeking it, you have a philia. If you fear the loss of it, you have a phobia. If you fear the gain of it, you have a phobia. If you desire to escape it, you have a philia. So you can never have a philia without a phobia. You can never have a fear without a fantasy. Now, this has been known, and rhetorical persuasion, and you might say the ability to market and sell, is to capitalize on people's fears and sell them the opium of the masses. So what happens is they take something you want, and they try to show you that if you don't have it, this is what your life will be, and show you the pain of it. Which go, I don't want that. That'll be frightening. Or they take something you don't want and show you the philia of what would happen if you could escape it. And this is the way to escape it. So all sales is capitalizing on the amygdala's assignment of pleasure and pain to events. And the more skilled the people are sell, the more vulnerable people are to buy into the assumptions. Now, the truth is, in your life, if you look carefully, when you meet somebody and you infatuate with them and you think, oh my God, I'm going to get more pleasure than pain in this relationship, a day, a week, a month, a year, or 5 years later, you find out it wasn't what you thought. You were blinded by an infatuation and you were unconscious of the downsides, which is saying that that pleasure that they sold you had pain that you overlooked. And if you meet somebody that you think is really terrible, a day, a week, a month, a year, or 5 years later, you find out, man, they made me grow. I became more independent. Thank you. They were a good a catalyst. So the truth is that there's both pain and pleasure in every event. But what we do is we tend to want to polarize it and separate the two. And the second we separate the inseparables and divide the indivisibles and label the unlabellables and name the inevitables and polarize them and create these polarities, we disempower ourselves. Because when we're infatuated with somebody, we have a disowned part. We're thinking they have something we don't have. We resent somebody, we have a disowned part. We think they have something we don't have. And that disowned part disempowers us. So anytime somebody's selling something and you're buying into the idea that they're going to give you a pleasure without a pain, or they're going to get rid of a pain and have no pleasures, or all pleasure, no pain, you know you've just been hoodwinkled. You've just been fooled. And fools fall for that. They're sold the opium.
Yeah.
The reality is that you take someone like Warren Buffett, and somebody tries to sell him how to get rich quick, he'd just walk out and say, that's ridiculous, because he knows the probabilities, he knows the facts. So people that live in the fiction and don't know the facts are vulnerable to the marketing and healthcare of a quick fix. And there's a multi-trillion-dollar marketing of pleasure without pain. Let's imagine this. I saw an ad. It was for irritable bowel syndrome. It was a drug. And it showed this person having really cramps and terrible things, and it showed pain. And then it showed drug. And then it showed pleasure and party and lovemaking and fantasy and this and that. Pleasure. Okay. And so the pain was referenced for a moment, and then there was the pleasure. So you get the idea. If I take this, I have no more pain. I'm no more suffering. I fear the loss of my pleasure, and I'm now getting the pleasure without the pain. But then at the last minute, now the last 10 seconds of the ad, it rattles off at 1,000 words a second. The side effects will cause cramps and bloat and cause diarrhea, and will cause this and this and this and this. And the very symptoms it's curing, it also causes. So what happens is they elongate the pleasure and shorten the side effects. And then people are gullible, and they don't pay attention because this one's too slow and this one's longer. So they pay attention to what's elongated. And so if people are vulnerable to the misinformation and highly polarized extreme information, then that's their own gullibility. And that's what wisdom is learning how to see both sides of an event simultaneously. Wilhelm Wundt, in 1897, in his Principles of Psychology, showed that simultaneous contrast stabilize, and sequential contrast and highly polarized information destabilizes people and makes them emotionally easily to control.
Ooh. So for, you're speaking to us too right now, currently. Our listeners will be, tuning in as well. But to us, this makes sense, right? Because Anna Kate and I both are, I would say not mass followers, right? We fill our brain and our body and emotionally, spiritually, mentally with things that we want to bring into our lives. But that honestly is not the average American. So if you're speaking to the average American who's listening to this and is like, whoa, wait, I need to step back and kind of reevaluate, how does the average American break free from that victim mentality almost in health?
Because they see the ad and then they go to their doctor and ask their doctor about it instead of going to their doctor and saying, hey, this is what's going on. What can you recommend? And what are the alternatives for a prescription? What can I try first before we go into doing one of these things? But America has it backwards. It's, oh, you see an ad on TV, go ask your doctor about it. No, don't do that.
So how do they break free from that mentality?
Well, I've been involved in education 52 years, and people who are more educated are more discerning in their selections of responses and selections of what they do for their care. And the more educated they are, the more they're willing to be accountable and look at the role they're playing in the dynamic and try to prevent it instead of just, do the hindsight treatment is not as powerful as the foresight prevention. So first, wake up and ask yourself, do I want to be gullible to the media that's got a motive for selling me things? Or do I want to care about my long-term wellness? Immediate gratification costs you. Long-term vision and deferred gratification pays. It's an ancient proverb with economics. It's the same with health. In fact, wealth and well-being come from the same root, wheel. They're the same thing, and the same principles apply. So if you want to get immediately gratified and wealthy overnight, you're probably going to be gambling and probably lose your money. But if you methodically save a little bit and the piggy banks become biggie banks, you might say. Well, the same thing in health. A little bitty daily activity that is preventive goes farther and is more cost effective in the long run than taking immediate gratifying pharmaceuticals that you have side effects from. If you ever take a pharmaceutical, I do recommend that you go and get the physician's desk reference online and go and find out before you take it what you're actually taking, because the side effects that you're taking you may be treating it in 3 to 6 months, treating that side effect with another pharmaceutical. Now, there's a place for pharmaceuticals. I'm not negating them, but just the question is that's not the first choice. It's wiser to educate yourself and look at your diet, look at your lifestyle, and do things that are preventive. That's well established in healthcare. The reason why they have it the way they do is because most people aren't willing to be accountable, like you said. But the question is if I just say, well, here's a quick fix, don't be accountable, I'm not doing my job as an educator. My job is to educate people, not be gullible, and not let impulses and immediate gratification and the subcortical area of your brain run your life. Let your executive center of self-governance run your life. You'll be more wise, more moderate, and more aware, enlightened. The amygdala assigns valency and makes you blind to half of what's there and makes you vulnerable to buy things that are going to have side effects. And you're going to think, oh, I need to get rid of those symptoms. The symptoms may be your friend. Wiser to educate yourself on what those symptoms actually might mean. Wiser to go and study applied physiology. So the wise, who are fewer in number, will probably educate themselves. The unwise that are impulsive will probably go and get a quick fix. And they will become a statistic, and the side effects that they face will be the next condition that they'll be treating in a vicious cycle. And they become victims of history, not masters of destiny.
Ooh, and that a vicious cycle it is. It's the reliance on those authoritative figures to tell you what to do with your health. And I'm just baffled where in history that happened. I know there are people who know more than me in the world. There's plenty of them, but nobody knows my body or how I feel more than how I feel, more than me. And so to place that entire trust into somebody else and just take it, for face value, rather than having any ounce of accountability or kind of education or empowerment type of feeling behind it is nonsense to me. But to somebody else, we get patients who come in and they have no idea where to start with their health. They have no idea at all. And that is a result of, in my opinion, years and years and years of training American society to be this way.
Yes. They haven't, but they've also, we have 7 areas of life we can empower in life. We have our spiritual quest, our intellectual quest, our business quest, our financial quest, our family and relationship quest, our social leadership quest, our physical health and well-being, and so any area of our life we don't empower, people overpower us. So if we don't empower ourselves intellectually, we'll be told what to think. If we don't empower ourselves in business, we'll be told what to do. If we don't empower ourselves in our finances, we'll be told what we're worth with Social Security. If we don't empower ourselves in our relationship, we'll be doing honeydew things around the house we don't want to do. If we don't empower ourselves socially, we'll be told misinformation campaigns. If we don't empower ourselves physically, we'll be told what drugs to take and what organs to remove. And if we don't empower ourselves spiritually, we'll probably be subordinated to some anthropomorphic geocentric deity that's probably a byproduct of our fears sold as a philia to compensate for our heavenly fantasies. If we don't empower ourselves, we're going to be overpowered. We're not a victim of people overpowering us. We're simply not having victory over our own nature. And so the first thing is to look within. People that look without do not empower their lives. People that reflect and realize the world around them is a reflection of what's going on inside them are the people that lead the way. So start the journey. Don't just assume you have to be the victim. You can be a victim of history or a master of destiny. I educate people on how to be masters of destiny. I educate people on how to wake up their potential. And that's an educational process. Education stabilizes the amygdala's volatilities and emotional vicissitudes, which stop people from empowering their life. But education, wise education, can stabilize and direct and wake up great leadership that we all have dormant, waiting to be awakened.
Yes. Yes. If it doesn't matter where you go, it doesn't matter how you get there. But we want to continue this conversation with Dr. Demartini next week. So make sure that you tune in and make sure that you educate and empower yourself with our vault of 5 free guides. So go ahead and grab that in the show notes below. Just click on that link, enter your email, and we'll send those 5 guides directly to your inbox. Some risks are worth taking, but is this one of them? Today, we're diving into the real impact of mycotoxins on your body, your environment, and why it's time to start paying attention. So where can we find mycotoxins?
Yes. So mycotoxins it's important. I talk to my patients about this. Mold species are everywhere, but not all mold is toxic. And we'll get into this a little bit more so. So it is naturally occurring in the environment, but there are places where it kind of bioaccumulates and grows a little bit faster and is more opportunistic. And we talked a little bit about this last week in that mold species, specifically ones that are found in food, Aspergillus, Penicillium, and Fusarium species, really thrive in damp, wet, hot environments. So when we think about food, the two that I really want to talk about is coffee and nut butters, because they are just notoriously high in mold. So, or in mycotoxins, I should say. So coffee, mycotoxins develop when coffee beans are not properly dried or stored. Again, high humidity, warm conditions, and also mass market coffee brands use lower quality, unfortunately, beans that are more likely to be contaminated with mold. Fun fact, I actually did not know this. Decaf coffee actually tends to have higher concentration of mycotoxins due to the way it's processed.
Interesting.
I know. I didn't know that. So for all you which weirdos who drink decaf anyway, what's the point? I'm just kidding. It actually tends to be higher in mycotoxin concentration. Nut butters, peanut butter and almond butter are kind of notorious. Peanuts obviously grow underground where Aspergillus mold thrives. So that is a close proximity, of course. Alpha toxins are common in peanut butter. Even organic brands can contain it. Just because it says organic does not mean it's mycotoxin free. Mm-hmm. Almonds, cashews, pistachios can also harbor something called ochratoxin A, another very, very common mycotoxin that I see all the time in patients' labs. Actually, it's probably the number one mycotoxin that I see in patients.
Side note, almonds are the highest nut in oxalates.
Yes, that as well.
So if you're eating lots of nuts and lots of almonds and you're inflamed and you're having some issues, cut out the nuts and see if it changes it.
100%.
Odds almonds. They're so yummy.
Really?
Yeah, they light me up.
Oh, wow.
Yeah.
I don't think I know someone who is so almond happy. I know people are coconut happy.
Yeah.
But almonds, I could do without them.
So when we went gluten-free, lots of things had almonds in it. So
yeah.
But I like the almond. I mean, I used to make sprouted almonds from home, and I would love them. And that would be something that I could eat because it was quote unquote clean. That doesn't mean anything, but I knew where it came from. Yeah. But it's still, the oxalates just
messed you up.
Yeah. My body does not like them. And when I get my massage, they come out of my back. Like my massage therapist can feel them. So, and they have.
She means the oxalates, not almonds.
Yeah, the oxalates. Yeah. So when your body detoxes an oxalate, it will come out of your skin and it feels kind of like fine. Sand.
Almost gritty.
Yeah. Mm-hmm. So
I was envisioning people thinking almonds were coming out of your back. No. So I just wanted to clarify, y'all.
Oxalates were coming out, which is a good thing. My body's detoxing well. So, and I've done some things and have reduced that occurrence of happening because I'm not overloaded with oxalates. So
better out than in, though. Hey, other contaminated foods, corn-based snacks. So corn is another big one. Chips, tortillas, popcorn, grains and cereals, wheat, rice, oats. I also want to throw in spices. Spices can actually be really high in mycotoxins as well. Dried fruit and wine, especially non-organic varieties, are high. Unfortunately, breast milk has also been found to be high in mycotoxins. And I say that only to show the prevalence and how it can bioaccumulate in the body. If breast milk is testing high for mycotoxins, that means it can cross that barrier. That means it is bioaccumulating in the mom. That means mom's exposure is high. So in terms of baby and that developing immune system and gut health for a very precious little newborn and through infancy, that is really important for us to know, and to know that our exposures, where they can come from.
Our moms taught that?
No.
Other than we just taught you, but
I don't think so.
That's not a conversation that happens of let's test, before you get pregnant, let's test your mycotoxins to make sure that you can do that before you.
Oh, outside of my world? No, absolutely not. I had never, when I had my first two babies, nothing ever was talked about in terms of what could or could not cross cross into the breast milk. Drug medications, that conversation is had, but nothing else environmental. Absolutely not. I know. Fascinating.
Now, can dad affect baby?
So dad could, can you save that question for next time?
Yes.
That's a really good question.
Stay tuned.
But that's more on impact. So yes, keep that in your brain. We'll see if we get there, remember, by next week. Alpha toxins, again, produced by Aspergillus mold, peanuts, corns, grains. One study found that up to 92% of peanut butter samples that were taken contained detectable amounts of alpha toxins, and that included many organic brands.
So could kids be allergic to not the peanuts, but to the mold?
Bing, bing, bing.
Because peanuts are high in copper, and you need copper, and that's a great source to get it. But if it's contaminated with mold or pesticides and herbicides and all of that.
So if you look at the uptick in allergies are IgE mediated, right? So we have an allergen come in, whether it's food, environmental, and we kids, let's say, respond in a histaminic way. This could be asthma, allergies, eczema, dry, itchy throat, nose, ears, whatever it might be. But are we truly allergic to a component of the peanut? Some kids truly are. Yeah. Absolutely. You do a reflex and you see the protein that within the peanut that child is truly IgE allergic to. If you have a kid who has all these allergies, but is not showing up as IgE positive to a food directly on lab work, then yes, they are absolutely reacting to the mold species. Most of my kids who have chronic eczema, allergies, asthma, have mold toxicity, most of them, because it triggers the same immune response as if you are inundated with allergies.
Right.
So that IgE response, mold is very, very histaminic in nature. When it breaks down, it triggers a histamine response within our body. What does that do to a kid with allergies? Well, it flares their allergy symptoms. So yes. Yeah. Wormhole to answer your question.
Yes. So, okay, where else do we find mycotoxins that we need to be aware of?
Ochratoxin, specifically coffee, dried fruits, wine. Ochratoxin by far I also see in practice from water damaged buildings. So alpha toxin, ochratoxin, both water damaged buildings are high culprits, but it's kind of sticking with foods. Those are 3. And studies have indicated also coffee beans have a significant percentage of ochratoxin, up to 45% in certain studies of coffee beans are tested positive for ochratoxin.
Yep. And most beans are dried. They're harvested and they're dried outside, and environment, yeast and molds and all things get it's just everywhere. So, but again, like we said before, that even going through the roasting process doesn't eliminate the toxin, which becomes the problem. So having coffee from a single origin source that mitigates that as much as possible would be a better option if you're still going to drink coffee. But coffee is coffee. If you like coffee, drink it.
Yes. Corn is also a big one. So there's certain mycotoxins that have shown up to 50% of corn products contain, and some even higher rates than that, contain mycotoxins. So the exposure is there. We will talk about kind of what that exposure can do. It is about the bioaccumulation, you guys. It's not a fear tactic. It is not one piece of corn that you're going to eat. It's not one cup of coffee that you are going to have, but it is about the bioaccumulation. What happens if you are around this food product all the time? You are consuming this food product, multiple times a day, or like me, coffee every day. Mm-hmm. What does that do to the body? And what happens when these mycotoxins build up quicker than you are able to detox out? That is what we'll talk about next week.
Yep. So bioaccumulate your knowledge and share this with a friend. And we will see you next week for why
the harms.
Well, why you need to be aware and why it should be on your radar. Is it a health fact that everyone seems to believe, but is it actually true? Today, we're putting what to the test?
Vaccines.
They're 100% effective, no side effects, 100% cure, all good to go.
And breaking down what the science really says. So the myth today, vaccines are 100% effective. The belief that vaccines are 100% effective to protect us from diseases without recognizing that effectiveness can vary and the reason why booster shots are needed in the first place to maintain immunity over time. This is just something that's not talked about. And it is true. It is false. If you ask anybody, even if they're whatever minded they are, if vaccines are 100% effective, the answer should always be no, they are not. But I think as a people, we are taught to believe that they are. And that's where the reliance comes from. The reliance of our immune system. Our immune system needs this product, needs this thing to protect us 100%. And then we feel safe and we feel, that we are taking care of ourselves or our children. Now, it's not to take away from their effectiveness, because there are definitely vaccines, there are vaccines that are very, very effective at retaining antibodies and protecting people. That is 100% true.
So to clarify, vaccines do have their place. They are not the term 100% effective is what is false.
Exactly.
Just to clarify, they have their place. They have a timeline. Newborns don't need to get 8 all at once in their tiny little bodies. So we're just putting that disclaimer out there that there is a place for them and they do have their purpose, but timing and efficacious.
Efficacy.
Yeah, that's it.
She tried.
Effective.
She tried. So I want to give a couple examples just to show that and use some data. So COVID-19, the Pfizer and Moderna shots or vaccines, which are two of the most widely used, right? They initially showed efficacy rates of between 95 to 94%, which is wonderful, right? If you are looking and want to have that implemented in your health, that is a wonderful rate at 95 to 94% in preventing symptomatic COVID-19 in clinical trials. Clinical trials are not real life, though. When things get out into the wild, they act differently, and every body is different. So you can have a clinical trial that might have, I'm making this up, might have 1,000 people in it. That 1,000 people is not representative of the entire world. So then you bring this product into the real world, and of course it's going to act differently. But it's important to know that and understand that. So for COVID specifically, the vaccine's effectiveness against symptomatic infection dropped to 60 to 70% from that 94 to 95% within 6 months after that second dose, which is why they started adding the boosters. Oh no, the efficacy is going down. Okay, we need to add another shot to bring it back up to that 94 to 95%. Flu vaccines are a great example. This, I feel, should be taught to every parent, every person, no matter what, it should be taught, because we just kind of go with the flow and we're like, yeah, we got our flu vaccine this year. But do you understand that it might not and probably won't actually be effective because the rates are so low? So flu vaccines, the annual flu vaccine typically has a 40 to 60% effectiveness. That means up to 60% of people are walking around and that thing didn't do a darn thing. The reason being is because it
might give you the flu.
We're going to ignore AK's commentary today. The reason being is that it can fluctuate depending on how well the vaccine strains match the circulating viruses. So if you think about it, the flu quote in traditional flu season, comes out is usually most prevalent September, October, November, somewhere in there, December. But the shot comes out in August. And so researchers do their due diligence and try to kind of predict what flu influenza strains are going to be the most predominant this upcoming flu season. Well, they're guessing. Yes, educated guessing. That leaves room for error, though, a pretty large error. And there's many people don't know that. They think it's a guarantee, like, oh, if I get the flu shot this year, it's absolutely going to protect me. That is what we're saying is false, is it's not 100% effective. For example, 2017, 2018 flu season, that rate of the flu shot, the effectiveness was 36%, according to the CDC, 36%. So you take 100 people who got the flu vaccine that year, and it may have protected 36 out of those 100 people.
That means 64 got the flu.
Or were not protected at all because it was not the right strain. So just don't put all your eggs into this one basket is my point here. HPV vaccine, Gardasil 9, designed to prevent HPV, shown up to 90% effective in preventing strains of HPV most commonly associated with cervical cancer. But again, doesn't guarantee 100% immunity or 100% effectiveness for every individual.
Can we dive into that a little more? Because in the age that we grew up, This was so right now it's Ozempic and Mounjaro and all of that are the things that are thrown in your face. This, for Gardasil, was thrown in our face.
100%. Yeah.
Like all the time. And my mom had the wherewithal to say, no, I'm not going to do that, because they recommended it for teenage girls.
Yeah. And unfortunately, now we're seeing the long-term implications that we don't have time to go into in this episode, but HPV has been actually linked to increased risk of certain cancers. So that is one, that, I mean, 90% effective could, is great in theory, but not if it's causing other issues later down the line.
Right. And we're 30 years after this all came out, and we were encouraged to do that. And now we're seeing
the results of it. Yeah, exactly. The one other thing I want to say about the flu shot is it actually, that's 2017 to 2018, that 36%, that actually had improved, because if you go all the way back to like 2014, 2015, it could be as low as 10%. 10%. So think about all the time, like when I was in school, I had to get my yearly flu shot. They would not let me in clinicals if I did not have my yearly flu shot. And you're telling me I did that for a 10% chance of protecting myself? Like, what are we doing? Let's, with 100% certainty, protect our immune systems more globally.
Yeah.
Like, pertussis is another good one. So pertussis, the DTaP vaccine has pertussis in it, which protects against whooping cough, right? The CDC reports that vaccine effectiveness against pertussis may decrease to less than 50% in 3 to 5 years. So every 10 years, you're supposed to get a Tdap booster, right? But after 5 years, that protection against whooping cough goes down 50%. So again, what's our answer? Our answer is to just keep giving and keep giving and keep giving. I challenge that with, what if we just protect our immune systems in their entirety and just be proactive and really gain strength amongst our immune systems, that no matter what comes our way, we're able to fight it off with more efficiency. That's foolproof, you guys.
That's well care.
That is well care. That is well care. So the notion that vaccines provide 100% immunity can absolutely foster a false sense of security, and it has. While vaccines can, yes, reduce the risk of contracting and spreading infectious diseases, no, absolutely no vaccine out there guarantees full immunity at all. Point blank, period. Take home point, boost your own immune system naturally, again, so that no matter what comes your way, you can fight it off with greater effectiveness.
How we do that?
How we do that?
How we do that?
Oh gosh, that's a whole segment on its own.
So hydration, making sure you're eating well diverse foods, you're taking your supplements that you need to boost your immune system.
Yeah.
Make sure you're not exposing yourself unnecessarily, and so maybe not unknowingly, but definitely not unnecessarily to things that attack your immune system.
Yeah, we have a guide for spring and summer seasons right now, and I put in there for adults and kids how to strengthen your immune system per that season as well. So check those out. But it absolutely starts with your lifestyle, how you're taking care of yourself, eating, sleeping, fueling your body, but then making sure if you are traveling, if you are around crowded environments, you are supporting your immune system with a great comprehensive multi that has all our micronutrients in it. I'm not talking about these fun little gummies, that have ridiculous amounts of synthetic ingredients and sugars, and dosages are subpar, but truly filling your micronutrient cup, protecting, even taking a natural antiviral if you need to. Something like Varicate or Veracid by Orthomolecular is a beautiful. Monolaurin, lysine, those are great natural antivirals if you're traveling. There's quite a bit. So check out the guides if you guys need a little bit more assistance there.
Done. All right. Until next time.
Let's discover together.
We hope in this episode with Dr. DeMartini has empowered you to question the fear-driven messaging in healthcare and take advantage of your well-being. Stay mindful of mycotoxins in your daily food choices, and remember that vaccines play an essential role in public health, but are not a silver bullet for disease prevention. Join us next time on the Discovery Doc podcast for more thought-provoking discussions on health, wellness, and the power of self-empowerment. Together, we can uncover the truth and create lasting change for a healthier, happier you.
Hold your horses. Before we ride off into the sunset, let's take a moment for a friendly disclaimer. The information shared on this podcast is for general, informational, and entertainment purposes only. While we strive to provide accurate and helpful information, we're not here to replace your trusty healthcare provider or doctor. Consider us your Discovery Doc trailblazers. sharing our knowledge and experiences as we journey forward towards wellness. However, remember to always consult with a qualified medical professional before taking any action based on the content of this episode. Like the Wild West adventure, this disclaimer may change occasionally, so be sure to check back for updates. Stay healthy, stay adventurous, and keep blazing trails with the Discovery Doc.